Hi everyone, I did effects of electrical stimulation on House-Brackmann scores in early Bell's palsy patients. So what is Bell's palsy? It is the sudden onset of paralysis of facial muscles on one side of the face due to inflammation of cranial nerve number 7. And some of the symptoms include inability to close the eye, tearing, drooling, facial pain. Some patients complained of itchiness in their eye, and when they scratched it, it felt like there was sand in there because it was so dry. So my case study was in South Africa, and there was a total of 16 participants, 8 male and 8 female. The case study started off with 29 subjects, but 7 refused to participate, and the other 6 subjects started the program, but they did not comply with it, so they had to be excluded from this entire case study itself. There were 2 groups, control and experimental group. Control and experimental group received the same type of physical therapy intervention. However, the experimental group received TENS to the face. And TENS is transcutaneous electrical nerve stimulator, which is basically just E-stim. To ensure that the patient's onset was in the acute phase of Bell's palsy, it had to be less than 30 days of onset. And the primary purpose of the study was to determine the safety and effects of electrical stim on House-Brackmann scores in the early phase of Bell's palsy recovery. And the study lasted 4 to 12 weeks post-onset. This is the House-Brackmann facial nerve grading system that my study utilized. And the House-Brackmann scale is used to assess the severity and monitor changes of a patient's motor recovery, abnormal movement, tone, and facial symmetry. So there's 6 grades. 1 is normal function, so no dysfunction at all, and it goes all the way down to grade 6, which is total paralysis and no movement on one side of the face. So the procedure in the case study, both the control and the experimental group received 5 minutes of moist heat applied to both sides of the face. The hot packs were 160 degrees Fahrenheit, double layered in towels, so they ensured that the patient's face wasn't going to burn. After that, the patients received 10 minutes of supine facial and neck massage. The physical therapist targeted muscles that supply the cervical branch of the facial nerve, like the platysma. And the massaging motions that they used was circular motions, kneading, and if they felt any type of trigger point in there, they did ischemic pressure as long as the patient could tolerate it to help rid that trigger point. And then they finished up with some effleurage to make sure that that patient was nice and relaxed. After that, they did 10 reps of exercises once a week in the clinic. They only did 10 reps of each exercise to ensure that the patient didn't have any type of muscle fatigue. And they also gave the patient a mirror so they can look at their face while they're doing the extra exercises to promote symmetry. The only difference is the experimental group received 30 minutes of facial TENS after this entire treatment that both the control and experimental group received. However, both groups did utilize a home exercise program 3 times a day. Here are some of the performed exercises that the physical therapist had the patients do at home and within the clinic. And these are actually some of the exercises that I see Bell's palsy patients that come to my clinic doing as well. So some of them are smile, closed mouth, and then open mouth. Raise your eyebrows as if you're being surprised. Attempt to whistle by puckering your lips and compressing your cheeks together. So as I said before, TENS is transcutaneous electrical nerve stimulator, also known as E-stim. And some of the contraindications for patients who could not use TENS or be included in this study is anyone who is pregnant or anyone who has a pacemaker or anyone who has sensing impairment over the electrode pad placement area, because they would actually be unable to feel the stim itself being applied to them. However, for the Bell's palsy patients, the settings were used to mimic the natural actions of facial muscles, and they were stimulated to target to enhance the facial control. For example, eye closure, they targeted the orbicularis oculi, and for oral mouth movements, they targeted the orbicularis oris. To get a baseline on where they should start with the tens, they tested the unaffected side of the face to figure out the intensity to use on the affected side of the face. So they applied the electrodes to the unaffected side. They turned the stem up until they saw a twitch or the patient felt a good contraction. And then they said, okay, yeah, this is our baseline. This is what we need to apply to the affected side of the face. And as they were doing it, they targeted 3 muscle groups on the face, and they applied the tens 10 minutes each to each muscle group for a total of 30 minutes. Here are the individual recovery rates. Both groups showed improvement at a similar rate of recovery. However, it's almost impossible to actually figure out whether the improvements were due to spontaneous recovery of the facial nerve or if actual physical therapy intervention played a huge role in that. However, the experimental group individually showed higher rates of recovery compared to the control group. If you look at group number 1, control was only 17%, whereas experimental was 38%. And then if you move down to group number 3, the control group improved 17%, whereas the experimental group improved 38%. So I think it did actually play a role because the experimental group did show a higher rate of average rate of recovery in comparison to the control group. So in summary, I listed some of the pros and cons to this case study. One of the greatest things I thought was the fact that PTAs can treat Bell's palsy, and they can also apply TENS to the face. So PTAs can treat Bell's palsy patients with massage, taking them through their exercises, putting hot packs on them, and applying TENS to the face to help them on their recovery phase. And the fact that this case study used the same physical therapist for all the treatment interventions, so the consistency was really, really good. E-stim provided to be a safe treatment intervention. There were no terrible after effects after these types of e-stim treatments. All the participants spoke English, so there was no miscommunication errors. And House Brackman grading scale is a very reputable source that they were using. Some of the cons were the fact that the participants were also limited by other obligations, such as they had to work because they couldn't afford to miss a day of work. They couldn't leave their family at home, so they couldn't go into the clinic to get treated. However, TENS for facial paralysis showed that it did not help nor deter recovery. So kind of in this standoff phase where does it really help or does it not help? And these were just some of the things that I thought that were good and bad about this case study. Hopefully you guys took something away from this, and thank you so much for listening.